You are listening to One with Paul Costello, a podcast from the Stanford School of Medicine.
Proposition 3, the Children's Hospital Bond Act, is on the November ballot. It authorizes $980 million for grants to nonprofit children's hospitals around the state of California. These funds can be used for the improvement and expansion of the state's children's hospitals, along with the purchase of new medical equipment and technologies. Opponents of Proposition 3 say that it only adds to the borrowing spree that the state of California has been on for years. Proponents say it will provide critical dollars to children's hospitals who treat the most serious injuries and illnesses of California's kids. We'll ask our guest, Chris Dawes, President and CEO of Stanford's Lucile Packard Children's Hospital, and Sherri is Government Affairs Director, why, in the middle of the nation's economic turmoil, a vote for Proposition 3 is still a wise investment in California's future. Chris and Sherri, thanks so much for joining me. So let's start with the basics. What is Proposition 3?
Proposition 3 is really about capacity and access. Proposition 3 is the Children's Hospital Bond Act. It will help children's hospitals meet the current and growing needs of California's children with serious and life-threatening diseases like childhood leukemia, cancer, heart problems, sickle cell anemia, diabetes, and cystic fibrosis. How Proposition 3 works is it will authorize $980 million for grants of not more than $98 million for each of the eligible 8 regional not-for-profit children's hospitals and the 5 University of California children's hospitals.
So the mechanism for this is that once, if voters do approve this, you apply to the State Finance Commission and they give you grants, they give you loans, they give you what specifically?
They give us grants. We have to apply. There's a rigorous criteria that's spelled out in the specifics of the proposition, and they then give us grants that are based on application. We have gone through this before, back in 2004, and I think the good news is that we have demonstrated, I think, to the people of California that we have used the funds exactly as we said we would.
Now, why going back to the well? 2004, the state voters passed a huge bond issue, and now you're going back to the well, and some of your opponents are saying, it's just been 4 years. Why do we need these additional dollars at this point?
We're going back because there's still an incredible need. All of the children's hospitals in California are at capacity. More and more children with complex health care needs are being referred to one of the 13 regional children's hospitals. We're at capacity. We need more room. And going back will enable us to get additional dollars to add capacity. There are several children's hospitals, for example, Children's Oakland, UCSF, that need additional dollars just combined with what they had to be able to rebuild their current facilities to meet earthquake standards.
And so when you say you're at capacity, you have no more beds.
We have no more beds.
And where do children who have special needs get referred when children's hospitals have no more beds?
They get referred to another hospital that hopefully will have a bed. So it may be a child in Santa Clara County may have to get referred to UC Davis, or in some cases even as far away as Los Angeles, and vice versa, depending on what everybody's needs are. The good news for us is that the last 2 years, the flu season for children hasn't been as bad as it could be, where we've been able to meet the needs of children. Sometimes it means that a surgery gets delayed for a day or two until there's a bed available. But we do need more beds. And what we find is that community hospitals are not treating as many pediatric patients. They are coming to the children's hospitals.
And why are they? When you talk to the voters, when you talk to the electorate, talk to people out there about the unique role of children's hospitals, what is the unique role versus what community hospitals play?
Well, I think the Children's Hospitals of California, first of all, serve about 80% of those children with chronic illnesses and complex illnesses. So they really serve as a safety net.
80% is a huge number.
Exactly. They really serve as a safety net for critically ill children in the state of California. And I think this is something that when we begin to talk about that to members of the community, to the populace at large, they really identify with that very quickly and have historically been very supportive of this initiative, the prior one and the current initiative, because I think they do really understand that these children cannot be served at your local community hospital. They simply don't have the expertise. And now, as we're seeing a growth in geriatric patients and the baby boomers making more demands on health care, most of your community hospitals, if they haven't already got out of the pediatric business, they're rapidly pulling out of that. They simply don't have the space and they don't have the expertise.
And when you look at population trends in California, what do the trends tell you about the need for future pediatric care?
Well, according to the state of California, their projections are that they anticipate the growth in the number of children in the state to grow by 35% over the next 2 decades.
That's a significant number.
So when you look at that, combined with the fact that we're already turning kids away, I mean, just to use Lucile Packard Children's Hospital as an example, last year we turned away over 400 patients because we just couldn't take care of them. What that meant was that some of them went elsewhere if they could find another facility, or more likely what happened is they had to wait. And we have children sometimes waiting several days, sometimes several weeks before we can admit them to take care of their needs. And that issue is going to get worse and worse as the population grows. So again, that's why this initiative is so important, to ensure that we have the capacity to meet the needs of California's children.
How concerned are both of you that voters, especially this year, with the meltdown on Wall Street, are going to be going into the polling booth or sending their ballot in by mail, and they're going to have significant issues and concerns about the economy, about borrowing, about state deficits. California is already $8 to $9 billion in debt. What do you tell voters about the economic concerns they have and why they should put those aside and vote for an initiative like this?
There are a couple of reasons. One is that though 980 million sounds like a large number, it is such a small fraction. It's less than 0.1% of the state budget. So the impact on the state budget is really minimal. And two, now is the time when we have to make these investments to ensure that all children will have access to appropriate health care. It's when times are tight, we're seeing a greater reliance on government programs and government services, and we need to make sure we have the infrastructure. If we don't build the infrastructure now, when will we? We can't continue to fall behind, and this is an important part of the infrastructure of the healthcare system of our entire state.
Sherri, you're an expert in state government, so what do you tell voters also who say, they're worthy causes, they're terrific, but I really do not think that propositions are the way to do government, that the legislature is walking away from issues and they're giving these to the voters, and the legislature should be dealing with these issues?
And what I say is, I agree. The legislature should be dealing with these. That is the ideal way. And the legislature did try to deal with this. This legislation, this bond, actually passed the state assembly in a bipartisan vote. And then last December, it got hung up in all the end of the year with health care reform. And at that point, they ran out of time. We pursued this at the support of the then Speaker of the State Assembly. So going through the state legislature is absolutely the right way to do this. But sometimes if they can't get the job done, or in this case, they ran out of time, and it was through their suggestion that we pursued this path.